from the very outset, we have always been saying that the Operation Center is at the very heart in our fight against this pandemic. We have a data-driven way of handling our cases, meaning to say on the grounds, you already know your data, which will now guide you in the programs and activities that you are going to go through. Our active contact tracing, is also improving, and this is one of the causes why our numbers are really decreasing. Aggressive contact tracing, and then you do testing, testing, testing. There is no way you can fight this pandemic without strategic randomized testing protocols that you have to put in place. And of course, we see also a very good partnership and relationship between our private sectors. You know that at the very outset of our fight against the pandemic, our private hospitals only allocated 10% of their bed capacities. But today we have 30%. There was a time when there was a lull in our cases, and still our private hospitals maintain the 30% bed allocation. And of course, there is a very good collaborative effort between all the sectors. We have our LGUs, our leaders here, including our Office of the Presidential Assistant to Visayas, NTF, IATF, our Department of Health also is very proactive. So all of these factors, if you look at it, it conglomerates so that we are able to address a surge or an uptick in our cases.
Mm-hmm. Dr. Mary Jean, aside from those many factors that you pointed out, what are other COVID-19 hotspots like the NCR can learn from Cebu? What would be your recommendations?
First, they need really an operation center that is centered on on addressing their cases. Meaning to say, there has to be a collaborative effort. Everybody should, be able to work towards one goal, which is to be able to identify, to know where the cases are. How come they have these index cases, the transmission itself. So this data should be analyzed in a scientific and logical manner. Secondly, the testing should be strategic, meaning to say you do not just test anybody, but mostly because, in our data, we have seen that these are household transmissions already. So with the variants that are all over place, no, we have variants of concern already or mutations with potential clinical significance whose transmissibility is already high. Then let us do contact tracing up to the household level and test them, because by then we would be able to know which ones really has the virus or not. It's not testing those symptomatic only. It has to be even the asymptomatic, the close contacts. And of course, you need your isolation centers. We have our TTMFs or temporary treatment monitoring facilities on standby always. Our barangay isolation centers used schools at the outset of this pandemic. And then we graduated. And of course, that our hotels, our private hotels are partners with us here. So there are also families and persons who would not want to be staying in the TTMFs for their quarantine or isolation. So they can afford to pay the isolation facilities that are our hotels. So this is actually a very much collaborative effort and activity of everyone that is within our sphere of actions. All agencies are working towards one goal.
Mm-hmm. Those were very good points, Doc. Now, we want to get your insight on some matters. The Department of Health and National Office, Doc, has recommended the use of rapid tests for travelers in COVID-19 hotspots. What's your take on this?
Well, even from way back third quarter of last year, we already had a guidance on rapid antigen tests. Remember that here in Region 7, we have a very proactive team. And so we conducted our own verification studies on rapid antigen test kits. So we know which brands, which manufacturers really passed our criteria. And then we follow the HTAC and the RITM guidances also. So we believe
Mm-hmm.
that antigen tests has a role, because if you have a high prevalent area like NCR right now, then they can use an antigen test. And a positive antigen test should be considered a positive already. They do not need really to do confirmation with RT-PCR. Provided the guidelines are set, who are the targeted population that you will be testing using the antigen test, then it can truly help them in finding their cases.
Mm-hmm. So, Doc, is it safe to say that you agree on the government's move to include rapid tests in results in the country's official COVID 19 case count?
Yes, definitely. Because we cannot, just rely on RT-PCR. You will be over, there will be an overwhelming number of cases using the RT-PCR. There are other test modalities that we can actually use in this pandemic. And one of that would be a rapid antigen test kit, provided I said that number one, the guidelines will have to be set. Number two, you follow the test kits that has a high sensitivity, particularly with a very high specificity. Number three, you should be able to select the population that you will be testing. And number four, it has to be conducted in a manner that the line lists has to be submitted properly also to the epidemiology and surveillance units for proper contact tracing and of course for purposes of recording.
Mm-hmm. Dr. Mary Jean, some hospitals here in Metro Manila and also in Calabarzon are nearing their full capacity for COVID 19 patients. It's been very challenging. How about in Cebu? Can you share with us your numbers?
Yeah, our current critical care utilization as of the yesterday's data is only 35%. All right. And the safe zone is 60%. Throughout this pandemic, especially when we had the second wave, we never really breached the 60%. But having seen our cases go down, correspondingly, our CCU are going down also. What are the lessons that we learned from this and which we believe are one of our best practices also? Number one, there has to be a very strong collaboration and a very strong referral system from the community level up to the hospital. So the one hospital command should be able to function as such. Secondly, we have to encourage our private hospitals to really open up their beds. During our time when we needed to, maintain um, the bed allocation for the private hospitals, the Department of Health Region 7 had to deploy manpower to these hospitals to help them out, including the giving also and provision of PPEs. Thirdly, we have to encourage our hospitals also not to admit asymptomatic and mild cases. These mild cases and asymptomatics should be given to the TTMFs or temporary treatment monitoring facilities. That's the reason why we had private hotels, accredited by DOH, DOT, and DOQ to become isolation and quarantine facilities so that those individuals who are afraid and would want to be admitted in a hospital can actually be catered to in these private hotels where there are also doctors and nurses monitoring them.
Mm-hmm. All those are going to help, Doc, very much in decongesting our hospitals. Now, on the vaccination program, Doc, this time in Cebu, so far are LGUs done with healthcare workers and ready to proceed to senior citizens, Doc?
Our data shows as of yesterday, in terms of our vaccination for healthcare workers, we are already reaching 80%. So there's still around 20% of our healthcare population that needs to be vaccinated. But yes, our LGUs are acting on the master listing already of our A2, which are our senior citizens, and A3, which are the persons with comorbidities. Now, the beautiful thing here again, Miss Riza, I think this is only the place, no, the region that has a very strong partnership with our private sector. We have what we call a Project Balik Buhay vaccination partnership with our LGUs, with our government, so that there are areas that are identified, including medical hospitals or centers and facilities that will be able to cater to vaccinating our community, especially when there will be a mass vaccination already.
Mm-hmm. Finally, Doc, while NCR Plus is under ECQ over there in Cebu, how do you ensure that the virus won't spread further? Considering, of course, the Holy Week is upcoming.
Well, number one, we have already implemented our protocols, no? So, hindi na tayo natatakot, no? Pangalawa, I believe people are already aware, no, that they have to be adherent to the minimum public health standards. Number three, we are implementing testing upon arrivals of all arriving passengers here to our airport or to our seaports also. As a matter of fact, this afternoon we are going to start already the testing of all arriving ROFs and OFWs at the international airport. And while we do the testing, they will be quarantined, and in 24 hours, we assure them that we will release the results so that if they are negative, they can be released to their respective LGUs, but if they are also positive, then they will have to undergo the mandatory quarantine of 10 to 14 days. So all of these are being put in place. Also, we have not allowed any activities, the usual activities that we have during Holy Week, no? So hindi natin yan inallow muna because we believe that this is not the right time yet for mass gathering and for people to be flocking together.
Mm-hmm. As always, maraming salamat. Thank you very much. That's Dr. Mary Jean Loreche, DOH Region 7 spokesperson.
Thank you, Ms. Risa.
Thank you, ma'am. Now, the health department is pushing for the use of a rapid antigen test among communities with a high number of COVID-19 cases. Undersecretary Maria Rosario Bergere told Agenda that based on existing guidelines from the World Health Organization, rapid tests are allowed in high-risk areas like the NCR Plus bubble. Bergere also noted that the rapid antigen test is only accurate among COVID-19 patients with symptoms and those exposed to infected people.
Nag-positive sila sa rapid antigen test, parang positive ka rin sa RT-PCR. No, we consider you as a positive or a confirmed case of COVID-19. Pero kailangan po nating paalalahanan ng ating mga kababayan. Gagamitin lang po ito dito sa ating mga komunidad na matataas ang kaso. Dahil ayon nga po sa ebidensya, ang rapid antigen test, accurate lang siya kapag dun sa mga taong may simptomas o di kaya ay dun sa mga taong nagkaroon ng contact sa isang taong may positibong kaso at doon sa mga sitwasyon na meron tayong outbreak katulad ng nangyayari sa ating ngayon.
The Interior Department has asked more local chief executives to explain why they were vaccinated ahead of priority sectors. Undersecretary Ipimako Densing said they issued show cause orders to 11 mayors, 1 governor, and 1 councilor for jumping the vaccination line. Densing warned that more local officials will be asked to explain as the agency continues to receive reports from the public. The DILG will also form a legal team with a representative from the Department of Health to evaluate the reports that they have received. Now let's check in on the latest COVID-19 vaccine updates from around the world. Germany will limit its use of AstraZeneca vaccines to people age 60 and up following reports of a rare brain blood disorder side effect. Now, those under 60, meanwhile, will only receive the Oxford-made shots if they are in high-priority groups. German health officials are also looking at the possibility of administering a second shot with a different vaccine brand. Brazilian biomedical center Fiocruz is planning to study the use of AstraZeneca vaccines on minors. The research firm has earlier partnered with the British-Swedish drug maker to attribute and eventually fully produce the shots. And Britain will focus on vaccinating its entire adult population before sharing surplus shots to other countries. The UK has inoculated more than 30 million Britons with the first shot and aims to do so for all adults by the end of July. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.